How do we put pressure into all coccyx canal?
With the thumb, so that you're coming off the ischial tuberosity, medial and ascending.
Right.
And they'll rise from that quite quickly. But the nerves that we can see here are shared nerves, okay? And they're coming all the way down, and they're coming into the coccyx, and this is the ganglion impile, where the two parts of the sympathetic nervous system are going to be coming together. And we can see, if you look at the simple lumbar plexus, this is shared by everything. And down here, coccygeal pain. So the differential diagnosis is all about that. But there's also, there are various tests that you would use, standard orthopedic tests. But if I'm going to use an internal technique, I've developed something called a Coccyx Provocation Test. And that Coccyx Provocation Test has to be positive,
right,
in order for me to go inside.
Now, is this the technique you were going to demonstrate to us?
It is indeed.
Do you want to do that now?
Yep.
All right, let's go and have a quick look at that. I'm not trying to rush you, but we are short of time on the show at lunchtime. We've recruited Neil as a willing coccygeal patient. Neil, thank you.
Sorry. So you ask the patient to sit upright in a neutral position, okay? And what's going to happen is that I'm going to use those three fingers. The outside fingers will spread the buttocks, giving access to the coccyx with my middle finger. So I'll bring him onto the side that doesn't hurt. I will literally just lift the coccyx and then drop him into hyperflexion. So drop down and I push the coccyx with my middle finger.
So we're lifting.
Literally, I'm going to be doing that.
Yep.
And if that coccyx is flexed, which means that the junction between the coccyx and the sacrum, the sacro-coccygeal junction, I'm doing that to it.
Yes.
He will rise off the table.
Okay.
And if he says it's a bit uncomfortable, it's not a coccyx.
Okay. Yeah. So it is very painful if it's positive.
There's no argument about it. The patient says, "Whoa." It has to be that strong.
And this is a provocation test which you can do fully closed. He doesn't have
Absolutely.
to do, there's nothing.
You don't undress the patient.
No.
You make sure that you say to the patient, this is what I need to do.
Of course.
Okay? And you explain it to the patient. They say, yeah, that's okay. You tell them that it's external. You tell them it's over their clothing. Yeah, that's fine. But I think it's very important. It's not just an internal technique that needs consent.
Oh, of course. Anywhere around the intimate areas. It's
anywhere around the areas, yeah.
Did you feel interfered with, Neil?
No.
You felt comfortable? Good.
We're still friends.